I apologize for keeping you all waiting. As the city reopens, it gets a little bit more challenging to get around nowadays, but I want to thank you for joining us today. And we are here in the Bayview Hunters Point community with President of the Board of Supervisors, Shaman Walton, our Department of Public Health Director, Dr. Grant Colfax, and the Department of Emergency Management Director, Mary Ellen Carroll. We're here at one of the first sites that opened to not only provide testing for the Bayview Hunters Point community, but to also provide vaccinations. No appointment necessary. We knew that the disparities that existed with this virus were going to impact primarily the African American community, but also the Latino community. And we're seeing those same disparities play themselves out in this vaccination process. So why are we here today? San Francisco is really proud of where we are and what we've accomplished. When you think about the fact that we're one of the most dense cities in the country, and we have had one of the lowest death rates in the country. And when we look at vaccination rates, 75% of San Franciscans are fully vaccinated, and 83% of San Franciscans received at least their first dose of the vaccination. So we should be proud. We're doing an incredible job. But with this new Delta variant, we're seeing real concerns. And those concerns impact especially the African American community and the Latino community. In fact, we are seeing African Americans, which represent less than 6% of the population in San Francisco, have just about 60% of the vaccinations. We see in the Latino community, although it's a larger percentage of the Latino community that has been vaccinated, over 70%, they are 2.2 times likely to be infected with the new variants. And why is this important? We're seeing the disparities play themselves out in our hospitals. Every person that is in the hospital at San Francisco General right now did not get the vaccine. And disproportionately, most of those people are African American. So this is important because what this means is life or death. We know the sad history of what happened in this country with the Tuskegee experiment. We know that African Americans were used for 40 years, not given penicillin in 1947 when it was widely known that that was a possible cure for syphilis. We know the stories of the sharecroppers, 600 sharecroppers in Alabama who were used, who were disrespected and discarded, who suffered. We know that in African American communities, and even in my own family, where my grandmother and her family members were sharecroppers, only one generation removed from slavery, what they experienced as far as racism and discrimination and concerns about trust in the vaccination process, we know that that is real. But this is also real. We're in a different place now, and the same people are experiencing some of the same challenges around concerns with trust, but more importantly, what we will see, what the data shows us, is that with this new Delta variant, we will see higher infections of those who are not vaccinated, and we can anticipate there'll be at least 250 more deaths. And disproportionately, those people will be African Americans and Latinos. So look, I understand the concerns. I understand people who are hesitant. I got the vaccine. And I got the vaccine because not only did I want to protect myself, I wanted to protect everybody that I came in contact with. I wanted to protect the elderly people that I come in contact with. I wanted to make sure that they were going to be okay because they are the ones that are likely to die because of this. So when I say it's a matter of life or death, this is serious. And that's why we're here today, That's why we're in the Bayview Hunters Point community. That's why I'm here with President Shaman Walton, because we understand the importance. We're not just using rhetoric. We did our research on this. We've asked the questions to our public health experts, not only here in San Francisco, but all over the country, because we knew people would be concerned. We knew especially African Americans would be concerned, and there would be issues around trust because of historical factors. And so what we're here today to talk about is not only this information and what this means as it relates to life or death, but the importance of us doing the right thing, doing our part, whether we're uncomfortable with it or not, protecting our relatives, whether we're uncomfortable or not, protecting our community, whether we're uncomfortable or not. This is important. And I want to thank you all so much for being here to get the word out. I want to thank some of my friends that are here who didn't want to get the vaccine. Thank you, Jamal Gregory, for getting the vaccine, even though Jamal was like, no, no, no. He works for the city. We grew up together. And he's like, okay, Mayor, I'll do it. I don't want to do it, but I'll do it because I understand the importance. That's what today is about. Understanding the significance of how we protect one another so that we can get back to the lives that we all know and love. I'm tired of wearing a mask. I'm tired of things shutting down. I'm tired of COVID. How we get over COVID and we keep the smiles on everyone's faces and we keep this city and this country open is we do our part and we get the vaccine. So thank you all so much for being here. And without further ado, I want to introduce the supervisor who represents District 10, where we are today, Supervisor and President of the Board of Supervisors, Shaman Walton.
Well, first, I just want to say good afternoon, and well, actually good morning, and thank you to our mayor. I'm here today really because I'm scared. And I'm scared for the Black community. I'm scared for people who are 25 to 40 years old. I'm scared for people who are refusing to get the vaccine. When we look at this new variant, and we've worked hard here in San Francisco, worked hard here in District 10 to get testing, to get the vaccine located in places where it was very accessible to our community. We've done everything we can, from pop-up sites to putting vaccination sites in every area of the district, to now having mobile sites that will come to your front door to give you the vaccine. We've done all that work not because we think it's something fun and exciting to do, but it's because we know the importance of the vaccine. We know what the data says. We know what the research says. Much like Mayor Breed, I have family members and friends who are not getting vaccinated because of the lack of trust with vaccines and because of history and what has happened with the Black community in terms of public health. I have so many arguments at barbecues and family dinners, and folks are getting information from so many places that is untrue. They're not listening to our medical professionals. They're not looking at the data. And here's the reality, and we already know this. The new Delta variant, folks who are getting sick and ending up in the hospital are folks who are not vaccinated. So we have more real-life data in front of us that tells us how the vaccine is working in our communities and why it's so important. Here's another fact. Right now today, and we stood here in the beginning of the pandemic, did a press conference to say how much we knew District 10 would be disproportionately affected by the virus, and we wanted to make sure that we had testing right here at this site. Mayor Breed talked about the elimination of barriers to getting the vaccine here. But here's the reality. The highest number of cases that are coming up now are in 94124 and in Bayview Hunters Point. And there's a reason for that. It is because we are not all doing everything that we can to protect each other. So this is, for me, is a cry to my community, a cry to everyone who has not gotten the vaccine to say, we need you to get vaccinated. It is important for you to keep yourself safe, for you to keep your family safe, and for you to keep the people around you safe. This is not information that we are making up. I had a meeting with Dr. Colfax the other day, and it really scared me because we're starting to see a rise in cases again. And those folks who are being affected and infected are people who are not getting vaccinated. You can come here Monday through Friday, get the vaccine, no appointment necessary. We also have the same thing at the Potrero Hill Health Center. We have a vaccination site at 1800 Oakdale. We have consistent pop-ups in community. We have sites in Visitation Valley. And we're going to continue to do everything we can to get to every nook and cranny where people are who are not getting vaccinated. We're having conversations about incentives. There are places where we have pop-ups. People are giving out groceries. They're giving out gift cards. And we're doing it and providing these incentives to save lives in our community. So please take advantage of the opportunity to get vaccinated today. And remember and understand that those folks who do not have the vaccine are the ones getting hospitalized and unfortunately the ones who are going to die if they don't take that precaution. There's a saying we have in community. We say it on the street, we say it on the block. It applies to us in health right now. I would rather be caught with than without. So please get vaccinated. Thank you all for being here. Thank you for helping us get the word out to our communities that need to know and get the right information so they can take the right step to keeping everyone healthy. Thank you.
Good morning, everyone. I'm Grant Colfax, Director of Health. Thank you, Mayor Breed and President Walton, for your great remarks. And I think if we just take a step back for a minute and realize that for every person in the hospital right now and for every person dying from COVID-19, those hospitalizations and deaths are nearly 100% preventable. 100% preventable. There's very little in health where we can make such a statement. And it's because these vaccines are so incredibly effective, People ask me, how do we avoid COVID? What are we going to do? Top 10 answer, get vaccinated. And until you're fully vaccinated, wear that mask indoors to protect yourself and to protect others. Now, you've heard the numbers, but I just want to go through just a few more. In the last 12 days alone, we have seen a threefold increase in COVID-19 cases in San Francisco. This rapid increase in cases is due to the Delta variant. The Delta variant is COVID on steroids. COVID on steroids. This virus is far more infectious than the COVID we were dealing with a year ago. So if you were able to avoid COVID, and I'm glad you did during this last year and a half, it's very likely now with these increasing rates that if you're taking risk, you could get infected. And again, this is entirely preventable. If we look at the case rates of COVID right now in the city, the rates are 2.5 times higher among Black African Americans, 2.5 times higher among Latinos. And as you heard the mayor say, right now, of those hospitalized in San Francisco, 28% are African American. And this is not just about older people getting hospitalized now. We are seeing younger people getting hospitalized. The average age, and for some of you this is still older, but the average age of people hospitalized in San Francisco is 48. That's much lower than it was. But let me tell you something else. A quarter of our hospitalizations are now people 35 and under. 35 and under. And again, this is preventable. So please get vaccinated. Low barrier vaccination sites are available everywhere. We have done so well. Over 3/4 of people in San Francisco are vaccinated, but the Delta is here. Protect yourself, protect your family. Let's get this done so we can, again, continue to do the things that we love and continue to emerge from COVID. San Francisco is in a better place than most places in the country. We have highest vaccination rate of any place in the country, but we still have more to do. Support your family, your community. We're here to support you. We'll get this done. Thank you.
Good morning. I'm Mary Ellen Carroll. I'm the director of the Department of Emergency Management for San Francisco. The San Francisco Emergency Operations Center remains activated and committed to keeping vaccine convenience available for all San Franciscans. We are at the forefront of the city's equitable vaccine strategy. While our large mass vaccine sites have closed, we have shifted our strategy to be more neighborhood-centric. And I want to be just 100% clear here. We have many opportunities for folks to get their vaccine and their tests throughout the city within their own community. Here we are at the Southeast Health Center in the Bayview. We're fully staffed. We have some folks here, as Mayor Breed said, who are going to get their vaccine today. We're so grateful that you are here to be an example to your community and friends and family. And as Dr. Colfax says, the Delta variant continues to be a very serious threat. So as we move forward, I just want to say to reiterate that the vaccine is safe. And in San Francisco, it is extremely easy and convenient to get one. We will continue to work together with our partners to make that vaccine and testing available. And again, we've done so well. 75% is great, but we really have to focus on our most vulnerable populations and protect each other. So thank you very much. And if you haven't got a vaccine, please go to SF. You can go to sf.gov, get vaccinated to find all of the locations.
Thank you. And I just want to thank a lot of our first responders and the folks who work here at 2401 Keith. They have been out and about from day one helping to get the community vaccinated. I've been told by so many people who live in this community, when they come to this location, they're greeted with a smile. They're treated with so much love and respect. And so thank you to all the folks who have been working throughout this pandemic, especially our first responders and healthcare providers. We truly appreciate you and all that you have done and will continue to do to get us to a place where hopefully we'll see 100% vaccination rate in San Francisco. All right, with that, I'll take a few quick questions, and then me and my people, we're going to go in there, and they're going to get vaccinated, and I'm going to hold their hands, and we're going to make it through this. So any questions? So the question centered around getting this message out in a different way, and I just want you to know, when we first started down this path, when we knew that this virus was going to impact the city, we knew that disproportionately, sadly, in low-income communities and communities of color, it has a significant impact. So we embedded an equity team into our response, including our COVID response. So we've relied on the community with messaging, a number of agencies that we work with that have direct relationships with folks in this community. They have been the ones to help provide various campaigns and ways to get people excited about getting a vaccination. But unfortunately, it has slowed down. We expected it to slow down. But when you look at what San Francisco is doing, and even in our communities of color and compared to any other major city in this country, there is no comparison. And we've done a really, really great job. We just need to do more, because what's important to me is saving lives, as it has been since the beginning of this pandemic. And we'll continue to push out new messages and do videos and other things that will get people engaged. But nothing, I think, is better than a direct conversation with someone who you know and love. Now, look, I didn't say an argument. I said a conversation. Not making people feel necessarily guilty or bad, but just helping them to understand. So all of us have to do our part because it's really about a relationship of trust. I mean, a lot of people that I've contacted and talked to in my family, yes, sometimes it turned into an argument, but the fact is I care about them, I want to see them safe, and we had these direct conversations, and I've had to even call Dr. Colfax on the phone and like explain that variant thing that you told me about. And part of it is, it's just really educating people, communicating, and us doing our part to get our relatives vaccinated and just trying to protect our community. For Dr. Colfax? Okay. Any data about what? Yes.
Oh, yeah, yeah. So the question was about, are we seeing any vaccinated people testing positive for COVID-19? So I think the bottom line is, if you're vaccinated, the vaccines are incredibly powerful in preventing complications of leading to hospitalization or death from COVID-19. These vaccines are also very good at protecting you from COVID, but there are going to be what we call breakthrough infections. My concern is, with all this attention on this breakthrough infection, this could be, if the difference between getting COVID when you're fully vaccinated and getting COVID if you're not vaccinated could be the difference between sniffles and suffocation. So I just really want to make that clear. Sniffles versus suffocation. The people who do get COVID-19, if they're fully vaccinated, the vast, vast majority will have only mild symptoms. So I think it's just really important to emphasize the fact that people need to get vaccinated. There will be some people who become infected even if they are vaccinated, but my goodness, my God, such a better outcome if you're vaccinated. The mayor said already at Zuckerberg San Francisco Hospital today, the people in the hospital, all of them are unvaccinated for COVID-19. You saw the report from LA last night. The people in LA Public Hospital with COVID, all of them are unvaccinated. We see the deaths. There was a report from Maryland last month. Everybody who died in Maryland from COVID-19 was unvaccinated. Get vaccinated. The breakthrough infections are important to track, but they are not what we should be focusing on right now. We should be focusing on access to vaccines, particularly in the Black African American community, including right here today. Thank you.
The question was, are we considering reinstituting mask mandates? And we're considering basically providing guidance on suggested mask wearing in certain instances. We do ask that people who are not vaccinated, when they go indoors, that they wear a mask. And those that are vaccinated, we don't necessarily have a mask requirement further than that, but we are looking at a change to the policy, but not necessarily a mandate. All right? Thank you, and now let's go get vaccinated.